Welcome to Conversations with Kay. I'm Kay Ryder. And every week I talk with Vermonters who are leaders in the fields of government, healthcare, education, the arts, and community life. My guest is Alison Calderara, who's the CEO of the Community Health Centers in Burlington, Vermont. And welcome to our radio listeners on 99.3 FM, WBVT LP. Welcome, Alison.
Why, thank you, Kay. It's a pleasure to be here.
Right now, congratulations on being named the CEO of the Community Health Centers.
Thank you.
Yeah, well, it's great. I like it. How long have you been in this leadership position?
Well, permanently since March, so it's been about 6 months.
Okay.
Mile a minute.
And how long were you working at the health centers before you became CEO, and what did you do?
Well, you know, believe it or not, I'll be celebrating 25 years with the health center this year. And when you ask me what I've done for the health center, I think maybe the right answer is, what haven't I done? You know, I think that over the years I've done what the health center has needed me to do, and I think that that has been part of the adventure and part of the excitement of working for an organization like this. And it's given me a good base. I think to grow the health center even more.
Well, I know that you were involved with development, community affairs, and things like that.
I also got an excellent background in the grants management of the health center. And for a federally qualified health center, that gets you, I think, an understanding of the regulation, an understanding of what it's meant to be in the community, and a vision of what it can be. And I think those things have been really important. And assessing the needs of the community is what we do best.
Right, right. Now, 25 years, my goodness.
I know.
Time flies when you're having fun, doesn't it?
I can hardly believe it. And you know what's so funny is that when I first started at the health center, I thought I'd be there 6 months.
Oh, really?
Yep, I took it. It was a kind of a part-time contract, and I thought it was just something I would try. And I walked in, and I was immediately captivated by the power of the model and the work that it was doing for Vermonters in their daily lives. And I've never lost that enthusiasm.
Great, good for you. Well, that's what we all need in healthcare is enthusiasm.
Yes,
because
we
it's
do.
hard. It's hard stuff, Alison.
It is.
So after 25 years, you actually knew a great deal about the community health centers.
Yes.
But the CEO position is a wee bit different.
Why, yes, it is. It is.
So did you have any surprises?
You know, I think that for me, I think one of the biggest surprises has been really to get to understand the challenges that are facing primary care providers, our dental providers, the healthcare providers on the ground doing the work, sitting in front of the patient, and with the understanding that healthcare reform rests on their shoulders. And what the importance is of administrators in ensuring that they can continue to do what is best for the patient. And I think that, you know, that sounds very simple, but it's really not. But I think for me that has been a real, opening of my eyes to what is daily demanded of our providers.
Right. So how would you personally describe the mission of the health centers?
We provide a welcoming, affordable healthcare home for each and every Vermonter.
That sounds good. Sliding scale and all that?
Sliding scale and all that. And also an access point for people who are enrolled in public health insurance. I think that's something we don't often talk about. We always tend to think more of the uninsured. But if
Medicaid.
If you have Medicaid, can you find a dentist? Well, you know, Vermont is actually a very special place. We have wonderful independent providers that can take up some of the slack, but they can't take up all of it. And I think federally qualified health centers have really been there to make sure that there is an access point for people, all people.
Great. I'm talking to Alison Calderara, who's the CEO of the Community Health Centers of Burlington, Vermont, the new CEO. Okay, now let's talk about the various places, your sites where you provide service, and what services you provide at these sites.
Okay.
Okay, now your Riverside Health Center, beautiful building by the way,
It is.
Is your main site.
It is. The mothership.
There we go.
At the Riverside Health Center, we provide a full range of primary and preventive care. We have a dental center, a 12-operatory dental center, and we also have a behavioral health program that includes psychiatry and licensed clinical social workers who provide drug and alcohol counseling and therapy. There's also patient navigators that can help people connect to health insurance and connect to all the little difficulties in filling out forms and that kind of thing. So there is a wide variety of services that are available there, and we serve all ages. Pediatrics. We have a pediatrician on staff who focuses on special needs kids.
Now, I read someplace that you give children books.
Why, yes, we do. You know, this is interesting because I think this is part of looking at the whole person. And when someone learns to read, and if you can invest in a child's reading skills and in their ability to read at home with mom and dad, that makes them healthier.
Yep.
And so we have the Reach Out and Read program, which is proven that increases reading at home with parents 20%. And that's significant. You know, as we look at investment, all those downstream investments for those upstream costs, focusing on the kids, learning to read. We make sure that each child who has a well child exam leaves with a high quality book to read at home with mom and dad. And by the time they go to kindergarten, they should have a library of good books. Simple? Yes. Worth it? Yes.
Oh, yes. Anything you spend in healthcare or education before age 5 is just the best money. And of course, healthcare starts right in the tank.
That's
exactly. If you can have a healthy baby.
If you can have a healthy baby.
You're in
and
better shape.
we provide the OB and prenatal services as well to moms that might be facing some sort of barrier to that.
But going back to books.
Yes.
I have grandchildren in California, and the other day I got a photo of my grandson sitting in bed reading. He's about 11 years old, you know. It was probably later than he should have been up. But anyway, you know, that's why I started with 11 o'clock. But anyway, he just was so engrossed in this book, I don't think he even realized the photo was taken.
Isn't that great? You know, as the child of a librarian, I really appreciate that. And also in healthcare, I appreciate that because, again, we talk about when someone is healthy, if the higher your education level, the healthier you'll be.
Yeah.
And we've got to engage kids.
Yep.
Right?
Yep. You have to catch young families at the right time. And I think when someone has that first child, they do want to do the best.
They do. They do. And sometimes they need a little help.
Yep. The VNA has always believed that.
Oh,
always.
Yes. We are aligned with the VNA in what we do and our belief.
Good.
And our ability to help the patient.
Good, good. Now, Dr. Peter Gunther and other MDs from Good Health are now part of the Community Health Center.
Yes.
Has this worked out well for your patients?
I think so. You know, one of the reasons why, if you look at Good Health, is an amazing practice. They serve 8,000 patients, many of them who are folks that are older. It's an internal medicine practice, not something that the health center had before. But one of the things that the docs at Good Health wanted for their patients is to be able to not only make sure that their practice would be sustainable in the future as an important access point for people, but also that we can provide the services that an FQHC can provide. And that is access to psychiatry, access to behavioral health, access to Suboxone treatment, or any other types of treatment that may not be easily available to an independent doc. And also, most importantly, sliding fee scale, and the 340B program, which is a prescription assistance and good price prescription program that also can deliver prescriptions to people at their door through
Would
mail.
you name this again, please?
It's called the 340B program. So all of those things are kind of bring together services for a population, an elderly population, in the case of Good Health, that will help make their life easier. And I think that it takes a while. Good Health just came on last year, and it takes a little while. But we're, again, I use the word alignment, but we're aligned. And I'm very proud that this organization and those doctors wanted to become part of the community health centers of Burlington.
I firmly believe that you need doctors out in the communities. I really do. And let's go on. You have a site in South Hero.
We do. Champlain Islands Health Center opened a new facility in November, and that is our only rural health clinic. And we took over that clinic when David Hobbs, who was a fantastic, legendary community health physician who served his community so well for many years and wanted to retire. So we came in and we were in a little building, the same building that Dave was in for a long time, and then we needed more space, so we moved to South Hero, up the street a bit. And this is an important access point for southern Grand Isle County. And again, we bring a range of services there. Connection to dental services. We use the Cider bus to get people down if they need affordable dental care in Burlington, access to psychiatry, and all of those things. I think the healthcare home aspect of it, and to bring that to those rural communities, is really important.
Do you do pediatrics up there too?
We do. Not so much. I don't, but family practice serves all ages.
Right. Yeah. Well, that sounds good. Now you have a new site in Winooski.
We do.
What family health do you call it?
Family practice, yes. Dr. Ann Goring and Dr. Ann Knott Ann Goring founded the practice. It must have been at least a decade ago. Committed to Winooski, and a little known fact is that Winooski is considered part of our service area as an FQHC. And so we've worked hand in hand over the years. We know each other well. She's created a wonderful practice there, very much needed point of access in Winooski. And when it came time for Ann to talk about sustaining her practice for the long run, it seemed a natural fit to be talking to the community health centers of Burlington. And so they just came on May 1st.
Now, Winooski is one of the few places where people can really find affordable housing, and many new immigrants live there in Winooski. Do you have interpreters on your staff? We do.
We provide interpreters in a couple of different ways. Predominantly, it really is telephone interpreters. And that's a service. It ensures confidentiality, privacy for the patient, and that's right at your fingertips in every one of our exam rooms. And this is it for all of our sites. At Winooski, that's the same thing, telephone interpreters. There are some cases, particularly when someone has a particular medical condition or it's a psychiatric issue, sometimes we'll bring in in-person interpreters as well. We do have in-person interpreters for sign language.
I know that the VNA has found that grandchildren will help interpret for their grandparents sometimes.
Right. And I think that is one thing that we try not to do that, because there are often some complicated...
Oh yes. But grandmothers will look at the grandchildren, and there you are.
It's true. And I think that sometimes you will see whole families in the room, but you also want to be sure that what are sometimes complicated medical instructions
you have to have privacy.
You do.
And yet, I picture in my head, a young boy or a girl helping their grandmother or grandfather in some way. And I think the VNA brings interpreters in for big problems.
Yes.
But how old are you? Where were you born?
Yes.
Things like that.
Yes.
Questions that the kids would know anyway. Interesting.
Yeah. You do get to see the family dynamic.
Yeah. Oh yeah. Now the Pearl Street Youth Center. this is a distinct population, young people.
It is.
And age range, what?
About 16, we see 16 to age 26. And you know, I think the way that I would put it, not your mom and dad's health care, right? You know, I think young people, depending on where they are in life, and this can mean a college student, this can be someone who's struggling on the streets. They are looking for a trusted adult in their lives. They are looking for a welcoming atmosphere, non-judgmental, and sometimes it is when at the right time in the right place. And so it's walk-in. Let's make it easy, right? And if you can get kids in there for those acute visits, then maybe long-term, you can get them connected to the healthcare home they need for a lifetime, right?
Right, and you must deal with addiction issues in that
Yes.
site.
Yeah, and you know, I think that Pearl Street has this unique niche that is very much needed in the community, and I think that, you know, we want to be sure, and I'm speaking as a mom who remembers the segue from the pediatrician, right, to a real primary care home. They want a place that they can feel comfortable, and I think Pearl Street offers that kind of unique atmosphere.
Now, you must also serve that age range at your main site, though.
Oh, we do, at all the different sites. I mean, that you know, if you think about the health center, you asked me a little bit about the mission of the health center, and you know, one of the things that you can think about us as a series of open doors in the community, on the street, and wherever you are. You should find a door that you feel comfortable walking through at the Community Health Center of Burlington. And I think that is Pearl Street, Riverside, Safe Harbor, Champlain Islands. You know, our job is to make sure that you can find that door.
Now, the Safe Harbor, you mentioned that. Now that's in Burlington, and it's a site for homeless people, actually. And why do homeless folks need a special kind of health care, Alison?
Well, I think a variety of different things. I think first and foremost, being homeless is hard work. And you're thinking about getting to the food shelf for your meal. You may be sleeping outside. You may be thinking about where you're going to find a bed for the night. Where, at that time, you need your health care to be easy to get to. It needs to be within walking distance. It needs to be open. It needs to be walk-in. And, you know, we need showers. We just did a renovation to Safe Harbor. And you know what? Sometimes people come in and they need a shower, right?
Oh, yeah.
We provide that. Sometimes you need your clothes washed. We provide that. Sometimes you need non-judgmental, holistic health care. Again, you're going to hear this a lot from me, that meets you where you're at. And you need a comprehensive set of services. Mental health, psychiatry, nutrition, social work, case management support. Maybe you need an outreach worker that's going to transport you to your specialty appointment. You need someone that's going to be thinking about all those things and putting together that little bit of a patchwork quilt that turns into your healthcare plan.
Now, the city of Burlington has had many problems with some, not all, but some of the homeless folks. And we don't have enough services for people?
Well, you know, I think we have services for people, but people need to want to access them. I think first and foremost, we need to make it easy for them. But I think mental health, that system is, and I can speak definitely from the health center's point of view on this, is that this is one of the reasons why that we created access in terms of walk-in, to be able to offer walk-in psychiatry for our patients. You need to be there when people need you. Can't navigate the system, and I think that I think all of us in the community will tell you that we're working hard to make sure that people can find the help that they need.
This raises the question, we don't have special hospitals for psychiatric services anymore. And you know, the whole idea of the concept of getting people who needed psychiatric help, you know, out of these centers, part of it was they were going to take their meds. and many of them didn't.
Right. Speaking from the primary care, from the primary care side of it, this kind of healthcare, it's complicated. And again, I think that, when I look at what the health center is able to do, it is that trusting, engaged provider who is available to you when you need it. And we do the best we can to be there. And I like to look at this as the need that we provide is that we're preventing crisis. That should be our job, right?
Yep, I think that's absolutely right. I skipped one of your sites, my goodness.
South End?
You have so many.
We have several, actually.
Yes, the South End.
The South End is on Pine Street, and that is a family practice, and we just opened 3 operatory dental center there to be able to offer some more services there. And dental has very close to my heart. We also have our school-based dental center at the Integrated Academy at H.O. Wheeler. And Kay, I think you've probably known me long enough that I'm very enthusiastic about the work, but I will tell you that the work that we do at the school is probably, in my viewpoint, probably one of the most successful public health interventions that I've ever been a part of.
This is dental at H.O. Wheeler.
Dental at H.O. Wheeler.
Right.
99% of all the kids that are seen there, this is a little 3-operatory clinic right in H.O. Wheeler, they arrive at school without a dental home.
Ooh.
They are
99%.
99% of the kids we see there, low income enrolled in Medicaid, and have arrived at school without a dental home. And I will tell you, if you arrive at school without a dental home, that means that you have caries, you could have infection, you could not know how to brush your teeth or floss, and you are not connected. And once you can get kids connected, then that is oral health for a lifetime. And the other thing I'll tell you, Kay, is that oral health and how your mouth looks is such a stigma for kids.
Oh, yes.
And it holds you back. And it holds you back when you're an adult from employment. It holds you back from self-esteem. I've seen us give dentures to adults, and they literally don't know how to smile.
Yeah.
Right?
Yeah. It's your image, isn't it? When you meet someone, you look at their face, their eyes, their mouth,
They're transformed
nose.
with teeth.
Oh, yeah.
Yeah.
Absolutely.
So I'm a huge proponent of catching the kids early, and I can tell you, I think that we've changed a whole generation of kids in terms of their access to oral health in Burlington.
This takes me back to my question about ophthalmology. If kids can't read, that's a big problem if you can't see.
Right. I will tell you that's ophthalmology, access to optometry and classes. Luckily, we've had some great providers in the community, independent private providers who are taking our patients. We're connecting people to some of the excellent programs that are out there. But I still have heard from patients loud and clear they would love to have this kind of a program affiliated with the health center. And that might be one of the things that we might look at in the future.
Right.
Patients would sure like to see that on site.
I bet you. Yes, I'm talking with Alison Calderara, who's the CEO of the Community Health Centers of Burlington, Vermont. She's been on my show several times. It's always fun to talk with her. Always fun. Now, do you think that the opioid crisis in Vermont is getting worse?
Well, it feels that way. I guess what I would tell you from hands-on, on-the-ground providers, it certainly feels like it's, we're stemming the tide, right? That said, we've made a lot of progress. We have made a lot of progress. Right now, as we speak, there is no longer a wait list in Chittenden County. And that's a major hurdle. And I can tell you the health
center... A wait list for what, Alison?
A wait list for Suboxone treatment. So if you are ready to go into care, if you are ready to go into recovery, you shouldn't have to wait. And at this moment in time, and I don't know, at this moment in time, I think there is not a wait list. At the health center, we have added 100 patients to the program. We have 365 patients that are in that program right now, and that makes us one of the largest spokes. I believe primary care spokes, which is basically just part of the program, the primary care program. And we've got to keep going. We cannot give up. This is heartbreaking. Mm-hmm. This is robbing families.
Young people of a future. Absolutely.
Absolutely. And I hope I never again need to talk to a heartbroken family because they've lost their child. Mm-hmm. And I am heartened by the work that I am seeing being done at a community level, partnering. I will tell you, the health center, working with the city, working with the Burlington PD, working with the hospital,
and the Howard
working
Center?
with of course,
yeah,
working
right.
with the Howard Center. I see improvement.
Good.
Probably not fast enough for these parents and these families, but it is changing.
Right. Now, that's good.
Mm-hmm.
It's a huge problem.
Mm-hmm.
Do you think that community health centers are in danger of losing their federal funding at this point?
You know, I can hardly believe that I'm saying this because I've been with the federally qualified health centers for many years. And as I sit and talk to you today, Kay, our 2018 funding is in limbo.
Oh my.
We are guaranteed through April 2018, but then our grant expires. We are not alone. Every federally qualified health center across the country, they will have their grant expired. Now, do I think cooler heads will prevail? Yes.
I hope so.
I do. I think so because federally qualified health centers have proven themselves. They have proven themselves to be cost effective. They have proven themselves to be the backbone of a safety net primary care system that no matter how much tinkering you do with the healthcare system in this country, you've got to have access to primary care.
Right.
Right?
Right. Yes, and that's why the health centers are really so important. As you said, the doors are open, and the doors are open all over Chittenden County and up in Grand Isle County, and you are part of that open door policy.
Yes, we are.
So I applaud what you do, and I thank you for coming again, and I wish you great luck in your new position, Alison.
Thank you, Kay. It's always a pleasure to talk with you.
And, you know, healthcare is important. Healthcare is so important for all of our citizens. So we have to think about who needs care, and everyone, I think, should have it. Thank you for coming, Alison.
Thank you.
And thank you for joining us on Conversations with Kay.